So many of the families that come in to get help for their children's attention, focus, or hyperactivity problems also sense there's something else going on, more than just hyperactivity or impulsivity. Or they don't sense that, they go in for an evaluation and they're dismayed to find that there's more than just ADHD going on. And what we call this in our field is comorbidity, which basically means the co-occurrence of two conditions or more at the same time. And there's a couple of different reasons why this might happen in kids with ADHD. One of them is that we know that things like anxiety and depression tend to cluster with ADHD just naturally, either genetically or biologically. But another reason actually is a little more concerning, and that is that children with ADHD, particularly older children with ADHD who have not received adequate treatment, frequently will develop depression or anxiety as a result of their untreated symptoms. And it's pretty easy to understand why that might happen if you're getting negative feedback frequently about your inability to focus or stay still. So what we really encourage parents to do is seek treatment and seek evaluations for kids earlier before they develop these sorts of secondary mental health issues. Regardless of whether this was something that was present at the same time from the very beginning or something like depression or anxiety that developed later kind of as a result of ADHD, we diagnose those conditions basically by trying to look at whether those conditions are informing each other, are present at the same time, or are actually related to each other. It doesn't really matter, in our opinion, if we see a child who has symptoms of depression or anxiety that seem wholly related to ADHD, we will still give a diagnosis for both conditions because it helps us know how to treat the condition better. And the good news is that frequently when you treat one of those conditions, you see improvement even in the other. One of the things that we find frequently is that kids that have anxiety or depression and receive adequate treatment for ADHD look less depressed, look less anxious, without them needing to have two therapists or sometimes two medications. However, in more severe cases, we will do combined therapy for both the ADHD and the other concern that's present. And we generally try to articulate our reasons for that early on in the treatment planning process with parents.